Welcome to another segment of Health Matters. Extended interviews with physicians, dietitians, and specialists from the University Medical Center. We use portions of these interviews on WVUA 23 News, and a podcast and web extra video of the entire interview is available to you online.
For this week's Health Matters, we are joined today with Dr. David Panting, a psychiatrist with the University Medical Center. And today we are going to be talking about Additionology along with the mental health awareness. So tell me a little bit about a basic definition of what Additionology is.
Well, first of all, I want to thank you for the opportunity to address all your viewers.
Yeah.
And Additionology is the science that studies the use of substances and abuse of substances and some behaviors that can also be addictive.
Yeah. What are some of the more addictive items or properties that you normally see?
We definitely think about it in two different ways. Again, substances like alcohol, which is probably one of the most addictive ones or most common, as well as pain medications or opioids that are also an issue now. And then there can be behaviors like addiction to social applications or social media.
Yeah. So I know all of those are probably a little bit different, but does one kind of have to do with the other, talking like behaviorally along with maybe environmentally, or how does it all?
Well, again, there's some tendency to have a biological predisposition, genetics, you can be born with it. Also, there's an environmental effect at what you're exposed to, what's available. And then again, the preferences. Sometimes there's a way of trying to manage some other problems that people may have, like self-medicating, we call it.
Yeah. And over the years, what kind of have you seen any trends or anything that's kind of been changing up until now?
Well, yes, there's always been trends. I think for the last 15, 20 years, the biggest problem has been opioids. With that, you can also consider stimulants as a big problem. We can have cocaine issues or methamphetamine also. And lately, fentanyl has been the one that has been causing a lot of problems.
Absolutely. What's kind of makes people go towards these substances?
Again, sometimes there's a biological predisposition, genetics, anxiety and mood disorders, depression can also lead to abusing substances, and stress. A big issue now over the last few years, trauma has become a very big as a cause of substance use that we have been able to identify.
Do you think people that have addiction problems kind of get a bad rep for themselves?
Unfortunately, it's been seen as a weakness or a character flaw. We now know that it's much more than just that. So, that creates a lot of stigma. And that's been a big problem of having people look for or search treatment or help because of the fear of being stigmatized.
Is there anything biology-wise that y'all commonly see that really sparks the addiction? Like, can you see when they're younger, they might have these struggles?
Yes, obviously, like I said earlier, traumatic experiences can become a promoter or a stressor that can lead to substance abuse, especially at sexual abuse or major traumatic experiences at a young age has been shown to be very more likely to lead to substance abuse later on in life.
Is there anything that you would advise people who have been through something that might be looking for other things of how to combat this?
Well, again, there is help out there. Obviously, having the support system, it makes it a lot easier, but I definitely encourage people to reach out to their family, their doctors. Mostly family doctors are usually much more accessible, and that can be a starting point. There is options for treatment, medications, therapy, and again, we're getting more and more options to helping people with these conditions.
Can you tell me a little bit how this coincides with mental health?
Yes, obviously there is what we call comorbidity. For most people, substance abuse comes along with other mental illnesses, basically anxiety, mood disorders, even psychosis like schizophrenia can predispose people to abusing substances and becoming dependent on them.
So with it being Mental Health Awareness Month, what do people really need to know about this?
Well, again, the message is to be aware that there is help. Just to quote Harry Belafonte, who is commonly known here in our area, that each one of us has within ourselves the capacity, the will, and the strength to make a change in our environment. And with that in mind, basically we're saying that no matter what you're going through, you have the ability to make some changes and hopefully become a better person by not letting substances run your life.
Yeah, because that was going to be, honestly, my next question is how, when you do kind of go down the substance abuse route or you do get addicted to other things, how that really takes effect and controls your life.
Yes, of course, there's different degrees, obviously, but for most people, the need and the cravings for the substance, rules most of their activities, their families, their financial assets, everything can be affected. So it doesn't only cause trouble for the person, but for those around it.
Okay. Well, is there anything that I haven't asked that you would just like to add about it?
Well, just remind people that there is help out there and there is ways of dealing with this. They don't have to do it alone. They don't have to suffer alone. And again, it's within them to make the change.
Absolutely.
Everybody has that possibility.
Well, thank you so much for joining us here today.
Thank you.